Today the topic is diabetes and nerve and kidney damage. To begin with, how does diabetes lead to nerve and kidney damage?
See, basic problem with diabetes we all know, it is high glucose. When the glucose level is increasing, it will damage the blood vessels basically. That is why it is whole body there is blood vessels is there. All damage can happen any part. It can be damage can be higher in some part and maybe slightly lower in more other parts. The most delicate blood vessels are in the eyes and kidney and brain and all. So it is naturally can get affected, and also the heart. All the blood vessels can get affected, and that is because of the glucose. Actually, all the cells are actually getting damaged because of the high glucose. And definitely in type 2 diabetes there is another problem that the insulin also is high. And even in the type 1 diabetes with obesity, there is type 2 diabetes also. That is accompanying type 2 diabetes also. That if the insulin level is getting high also, that is also damaging. So both ways it is damaging. And for the diabetic patients, that organ damage and other things are happening because of the damage produced by the insulin and glucose and also insulin.
For diabetes patients, normally when they come to know that they are having high blood sugar, initially the early symptoms are thirst or hunger or fatigue, tiredness, and so on. But at the same time, regarding their kidney health or their nerve health, normally there are no symptoms, and the patients also don't seem to be affected. So what is it that the patients should consider when they realize that they have high blood sugar with respect to their kidney health and their nerves health?
The diabetic patient should understand one thing first. The diabetes is a lifestyle disease, and you cannot cure a lifestyle disease with medication. That is the first basic understanding one should have. That it can be, when you are diagnosing, it can be type 1 diabetes or type 2 diabetes. Type 1 diabetes means it is a condition where the insulin is insufficient. That comes only less than 10% of the population or diabetic patients. That is usually occurs in that's an autoimmune disease usually in small children. But type 2 diabetes, the adult onset diabetes, and even many of the nowadays, even teenage onset and all is some sort of type 2 diabetes only. In 18 years, 19 years and all comes type 2 diabetes only. And they are also thinking that they are type 1 diabetic and they are taking insulin. Actually, many of the patients who is thinking that they are type 1 also can be type 2. So if it is a type 2 diabetes, it can be reversed provided you are taking adequate care, or you're modulating your lifestyle according to your body patterns or your body genetics and your lifestyle pattern. You have to control your food and exercise also. To protect your kidney or protect your eyes, that is the only way out. If you start taking insulin or medicine, there you may be controlling your glucose, but you are actually increasing. Many of the medicines currently available is actually increasing the glucose level is reduced by increasing the insulin level. So that a high insulin level also is hyperinsulinemia is also damaging your blood vessels and your system. Anything is excess is it's not good. It is considered as a toxin. Even the glucose, if it is go high, it is a toxin. Even the sodium, this common salt, if you take more, it is damaging. Even nutrition also, if it is excess, it is damaging. It is a toxin. And also if it is reduced vitamins, minerals, many with these diabetes patients and all, many of the vitamins are in a low stage also, or minerals, essential nutrient will be low also. The calorie and glucose and cholesterol and these triglycerides will be high, but the other many needed nutrition will be low. So the body building and or this regeneration of when there are cells are getting damaged, you had to replace it with healthy cells. That is not possible when there is nutritional deficiency also. So that is why this we are not able to cure the diabetes, or we are not able to, even with meticulous medication and insulin injection, you are not able to prevent this neuropathy, nephropathy, cardiac problems and all for the diabetic patients. You had to control your lifestyle. That is the basic cause of the disease is your lifestyle, your food pattern, your exercise pattern. That you had to correct.
So when a patient realizes that he has got diabetes, his blood sugar levels are high, then what are the tests that he should do, and what should he understand from those tests for the status of his kidney health and his nervous system's health?
So ideally, that person should check the organ studies they had to. They should look for definitely a renal function test with the GFR. Usually, renal function test we get previously only this creatinine level, uric acid, and urea, etc. But the most sensitive is actually uric acid is definitely good, but usually when uric acid is high, generally people start taking, or doctors prescribe flavoxate and uric acid production blocking agents. But many of the cases, especially along with the diabetes, uric acid is high because maybe they are taking too much of protein food or too much food. So too much uric acid is coming. But it is an indicator of the kidney function also. The kidney is not able to expel the uric acid. Uric acid will be produced, but it will not be going out. And that is the same reason the creatinine also is, or urea is also increasing. That is the end result in when the renal function, kidney function is gone. Urea, uric acid, those things are produced and it has to be excreted by the kidney. But the kidney is able to excrete it in the correct way. That is why it is increasing. If it is increased, especially the GFR is coming down to below 90, that stage itself you have to take care. If it is come to 80 itself, if you are willing to correct your lifestyle and come out of medication, see, all the medicines are stressing your kidney. So whatever, even the most commonly prescribed medicine for the diabetes is metformin. It's not major. Next day you are not going into renal failure or anything, but gradually it is increasing the workload of the kidney, and the high glucose is there, and high insulin level is there, and along with that is these medicines will increase the workload of the kidney. So you won't be able to come out, you will not be able to come out of the disease. It will be slowly progressing only. That is the reason the end result of the diabetes is some of the complications of either kidney failure or cardiac failure or ulcers, amputation, and all happens because of that. So what we had to understand is, we had to do is, you had to check the kidney function, you had to see the liver function. There will be, most of the diabetic patients are having fatty liver. You can check an ultrasound sonography. You can see what is the situation of the liver, and the liver function test, whether the enzymes are increased. Many of the diabetic patients can be using alcohol also. So the alcoholic hepatitis, and along with that non-alcoholic hepatitis, or non-alcoholic hepatitis may be there. So the liver is also damaged. And the cardiac function also you have to see. Cardiac markers, HSCRP, troponin. There are many markers which indicates the cardiac status also. And also you can see what is the status of the atherosclerosis. You can take a CIMT of this carotid intima media thickness and a cardiac echo. You can see if you are most of the diabetic patients are hypertensive also. So what is the whether there is any stress on your heart, to see whether there is left ventricular hypertrophy. That is the if the cardiac system is with the BP and all, diabetic patients mainly, if the heart is stressed, the muscles of the heart, the left ventricle, left heart that is pumping the blood to the body, that will become thickened. So when the coronary arteries, the blood is supplying to the heart, if that is blocked also, when there is more muscle and less blood circulation, you can get a heart attack or angina, and sort of things comes because of that. So you had to check all these things and see what is the situation of your body, and most importantly, you should check the functioning of the pancreas also. So if this everything is comes under diabetes is from the pancreas. So you should see how much insulin is produced in the pancreas. If it is a type 2 diabetes, if it is a familial tendency is there, maybe the insulin level will be normal. Or some patients, the insulin level will be very high, especially those with obesity. So that is also you have to see. And if you are taking insulin injection, then you have to see the C-peptide level. That is giving an idea about how much insulin is produced in your body. It is whether it is insulin can be the injected insulin or which is produced inside the body. So this can distinguish whether it is a type 1 diabetes or type 2 diabetes. And if it is a type 2 diabetes, the people should understand that if you are willing to correct your lifestyle, it can reverse. And that is there is no medicine to reverse the type 2 diabetes. And so, or even just only control, but controlling glucose at the cost of increasing the insulin mainly. There are few other medicines which is not increasing, that is new medicines are there. But any medicine will have side effects. That for sure. When we are taking medicine, we should all understand that it can be having side effects also. For a short time, it's okay, but for the diabetes, you're taking for lifelong. You're not getting out of it unless you're willing for a lifestyle correction and control your food and do moderate exercise.
See, when a person is diagnosed as diabetic, then soon after, normally what happens is some checks and tests are done, then their BP will be seen to be high, they will have obesity, cholesterol will be high. Then finally this diabetic patient is taking medicines for this cholesterol, medicines for BP, medicines for diabetes, and at the same time he also knows that his kidney can be affected by his diabetes. How does such medications affect the kidney in a negative way?
See, all the medications are stressing your liver and your kidney, because when you are taking the medicine, you just gone directly. If it is by oral medicines, everything goes directly into the liver, and liver try to destroy it or just to metabolize it. What is the correct word we are using is metabolize it. Liver sees it's a toxin, and it will be metabolizing it, and either it will go into with the bile and excreted in the stool, or it will go the metabolite also, or go into the blood and excreted by the kidney. So that is the fate of any medicine. Only those which is escaping but there only 10% and 20% may be escaping liver's first pass metabolism. That is usually called first pass metabolism. That is actually giving you the effect. Even the pain relief, everything. So, what you take is, if you are taking 1 gram, maybe only 10 milligram is really reaching as a medicine. But that also it has to be in the second circle or third circle of going through the again it is going through the liver and it will be excreted. That is the system. If it is when the liver is not able to do, it will the kidney has to take care of it. And when the kidney is got sick and when you are taking every day, so the kidney and liver is get exhausted, and then you finally get a liver hepatitis or cirrhosis. Liver will go into that stage, non-alcoholic hepatitis or cirrhosis and liver damage. The kidney GFR will come slowly down, and then next stage that albumin and protein started losing. Protein is needed for your body build-up. You are taking protein, but it is lost in the urine, and that sign shows the kidney is able to hold the protein. So the kidney damaging, and that is the blood vessel damage actually. That blood vessel, the kidney blood vessel damage we can see in the urine, albumin. But at the same time, your eye blood vessels are getting damaged, and your brain blood vessels are getting damaged, and the heart blood vessels and the whole blood vessels in the body is getting damaged. Even the blood vessels supplying your nerves to the tip of your fingers or the toes also getting damaged. That is why you are getting a peripheral neuropathy. This glove and stock anesthesia, sensory losses. That is typically what we are calling it. For you may get numbness or burning sensation on the feet or the fingers and all.
So, in the case of the nerves, normally what we hear is that if there is any nerve damage, it is impossible to again recover and come back to the old condition. The only thing we can do is to prevent further nerve loss or nerve damage with medications. At the same time, we also hear that with the lifestyle modulation correction, it is sometimes possible to recover from nerve damage, especially that of diabetic origin. What is your experience?
See, diabetic neuropathy, you cannot reverse it with medicine, even with insulin, any with diabetic medicine or with any medication. You cannot reverse the neuropathy with a medicine, but you can reverse, at least not fully, at least partially. That depends on the extent of the damage. In my experience, most of the patients who is saying that sensory problems, this proved conduction loss, usually what we are checking is from symptomatic, if you are getting numbness and burning sensation, those already damaged, and also this skin lesions or non-healing ulcers or this callus formation on the sole and all, shows that there is a lack of damage is there. But in such patients, what I see is what my way I'm giving clinically supported lifestyle correction. In that, actually, we are ensuring all the nutrition, there are 57 nutrition including water and oxygen, and we are ensuring that all is got in the correct proportion for the patient, and also we are ensuring all the body, all the muscles, around 650 muscles are there in the body. All the muscles are exercised in a phased, and maybe many patients are very sick. So in a gentle way, basically lying down or in a sitting position, they're able to do all the stimulating all the muscles. That is the only thing which can do our body voluntarily. The voluntarily what we can do is only to stimulate these skeletal muscles. So you do it in a systematic and way, stimulate all the uh, skeletal muscles. And skeletal muscles, when it is stimulated, naturally the bones are stimulated. It's all attached to the bone. So our immune system is residing in our bones, in the bone marrow. So in that way you are in simultaneously stimulating your immune system. Finally, the healer of your body is the immune system, not the doctor, not the hospital, not the medicine. Only the medicine and the doctor can prescribe medicine, and the medicine can support you or get time. That is especially very important in case of infection or a blood loss injury. You can the stitching of the wound, or controlling the blood loss, or giving antibiotic or antiviral for an infection. That's all to buy time. But finally, the curing you is your immune system. To assist your immune system, what you have to do? Stimulate your bone marrow. That is only possible with the exercise. And give nourishment to for the body to get out of sickness. The body has to make new cells, which is all damaged cell has to be removed and produce new cells. To produce new cells or replace the damaged with a new cell, a healthy new cell, you need nutrition, nothing else, not medicine. You need nutrition for that. Nutrition means this 14 vitamins, 14 minerals, around 20 amino acids and fatty acids, especially the essential fat. That is the controller of immunity, immune system. This is omega-6 and omega-3. The omega-3 is the healing, taking care of the healing part, and omega-6 taking care of the inflammatory part. You just notice that all these lifestyle diseases are called inflammatory disorders. Where the inflammation is in a high level. There is toxin. Glucose is a toxin. Cholesterol or the triglyceride, excess fat, excess lipids in the body that acting as a toxin. Excess glucose is a toxin. And we are adding again toxin as the form of a medicine. The body considers only the nutrition as a needed thing. All the other things are toxins. And even the nutrient in excess quantity, like high glucose, high triglyceride, or even sodium, the common salt which you are eating, anything, sodium is not necessary for the body, but if it is excess, that is a toxin. So that we have to correct. So give enough nutrition for the rebuilding of the cells and reduce the toxin level in the form of cosmetics, or in the form of food additives, or in the form of pesticides, which is coming along with the food, or along with the medicines also. If you are able to reduce the medicine or minimize the medicine and ensure enough nutrition and enough correct stimulation, you can get out of all these problems.
In the case of our kidney health also, what we hear is that once the kidney health is affected due to diabetes and the kidney function has become lower, then it is generally not possible to reverse that by medications and other means. At the same time, we hear that this lifestyle correction and lifestyle modulation can reverse the problems of the kidney and help it to regain its health. How do you see that?
See, diabetic patients, if you are careful, you can diagnose renal function deteriorating it's a very slowly progressive disease actually. The diabetic nephropathy is very slow progressive. If it is diabetes nephropathy alone. If it is end stage, that is after fifth stage of that is GFR below 15, or if the creatinine is above 4, then it is very difficult. But if you are in the early stage, if the GFR is, ideally GFR should be 90, but there is a lot of difference in the medical field itself actually in different countries. I have seen that many countries the report GFR above 60 is considered normal. In in India actually we take it as above. Yes, actually it's not only in India. It is actually the kidney GFR should be above 90. But there is no treatment generally to give for if it is below 90. Maybe because the lab is giving such a report, because not to make the patients panic, because there is no medicine to give. But you can reverse the kidney problems, kidney deterioration, if you are finding it early. That is my experience. I am basically giving clinically supported lifestyle correction by ensuring optimal nutrition, optimal exercise, and reducing toxins. That is the basic principle of it. If the GFR is 70, kidney patients 70 or above 60 is actually in one stage, or stage 2. 90 to 60 is considered stage 2 actually. In that stage we can reverse it, and it may not be even the stage 1 means the GFR is okay above 90, but there is albuminuria is there, that is stage 1. Stage 0 is no problem, that is the stage 0. Even with the GFR, but an albuminuria is there or a uric acid is high, it is considered as a stage 1 renal failure. And if the GFR also comes down below 90 but above 60, it is stage 2. If 60 to 30, it is considered stage 3. And next is between 20 and 30 is 4. 4, and after 15, it is considered as a grade 5. So even if in the grade 5, I had seen patients which is around creatinine level around 6 and 5 and below around 5 and all, we can even bring back the patient to stage 4 level of kidney failure. But if it is in the 4, we can bring it up to the 3rd level. And even if it is 3rd, that is above 30, we can definitely bring it up around to 60 and all. Next level we can bring it up. And around 60 can definitely, diabetes alone, you usually will be able to bring it above 90. There are so many patients, not 1 or 2. We don't consider it as a major issue at all. And many people, the creatinine can be brought up. And we have seen patients with, who are on long-term diabetic patients who has ended up with a heart attack, and they're not able to do angiogram because of the renal function is low. The GFR is 18, 20 and all. Most of the hospital won't do. That is the correct way of doing, because even if we are able to put a stent or something, your kidney function is going to be affected. So in such cases, they won't do a GFR. There are patients who comes for like that. And even that levels within 1 or 2 months, it was brought up above 40. See, that is the thing. So you can bring it up, but provided only with lifestyle correction and providing what is necessary for your body, not with medication. Medication is always adding strain on your kidney, and you cannot bring back the kidney function with medication. Only thing you can suggest an artificial. Basically this dialysis is a artificial kidney that is you are renting. You cannot put it inside you. So artificially you are renting it for 1 or 2 hours to clear up your this thing, or otherwise this peritoneal dialysis, and finally the renal transplant. Even renal transplant also, if you are doing also, you have to use heavy immunosuppressants. When you are using immunosuppressants, it is not ideal for a diabetic patient. Their kidney function will go down again fast, because you are on. I had patients like that. One person, he had a renal transplant. He's heavily diabetic and he's taking so many medicines for the, because already 3-4 medicines for the immunosuppression itself. And when you are taking immunosuppressant, your sugar will not be controlled. Whatever amount of insulin you inject, you won't, it will get not controlled. And again, his renal function has gone below around 40 something, because this transplanted kidney. And within a month, we are able to reduce, taper of all the medicine. Diabetic medicine is only type 2 diabetes, we are checked, and insulin level and C-peptide is okay. So it's first day itself he is able to control his, we got his control of blood sugar. And within a month, he was out of all the medicine except this immunosuppressants. He was taking very strong immunosuppressants, I think 3 medicines, plus because of that he has to take a anti-acid, this proton pump inhibitor, to reduce the gastric discomfort. That 4 tablets we cannot stop. That he has to take it lifelong. And his renal function has improved to, I think last time he is checked around before 80 actually. I don't know. I don't remember whether it has come above 90. But it will, if he is following it, he can keep it up. That means even a transplanted kidney's life can be improved if you are out of medication. A transplanted kidney, they should not take any reduction in the immunosuppressants, because it is needed to keep it there. But all the other medications can be stopped. That will increase, that is needed for any kidney failure patient, or any patient who has gone for a renal transplant. They can continue with the immunosuppression, but all the other medicines can be stopped. And I had seen that many, even it's very difficult to control the BP actually. Even BP, even those patients who are on renal failure, BP also can be controlled with the lifestyle correction. It is the proper lifestyle correction we have to. Don't wait till this 5th stage. When you are reaching the first phase of kidney failure itself, try to reverse it. Then it is easy, and you can have a perfectly okay kidney function.
Actually, when we talk about neuropathy, we realize that the brain is actually one of the most important centers of nerve centers. So, in the case of the brain also, this diabetes causes damaging effects. And what is the nature of that problems associated with nerve damage in the brain due to diabetes, and what is the current situation with respect to any medications to reverse such damage, and the lifestyle alteration possibilities of such damage?
See, the diabetes is damaging the blood vessels. The brain has, just like kidney and the eyes, brain's blood vessels also are so fine. So they are affected at an early stage itself. And when you look into the patient population who is having degenerative disease of the brain, like Parkinson's disease, dementia, Alzheimer's disease, most of them are diabetic patients. Maybe 95% will be diabetic. I don't think there will be anyone without diabetes or hypertension having these problems. Diabetes is damaging the brain 2 ways, especially the type 2 diabetes. That is, one is insulin, and the one is sugar, definitely. That is, we are calling it, basically we are calling diabetes only because of the high sugar. But the insulin level or type 2 diabetes, most of the patients insulin level is also high, or we are increasing insulin level by medication or by giving insulin injection. This increased insulin also damaging the brain. So that is the reason you cannot reverse or even not even prevent progression of the brain problems, dementia or Parkinson's disease, anything with the medication. You can symptomatic relief you can get if it is Parkinson's disease. You can get L-DOPA. That is actually your brain is not producing enough neurotransmitter, that is dopamine. You are not able to, so you are giving a dopamine precursor like L-DOPA. That is the only thing you can do for that. So if you want to protect your brain, if you want to reverse or some sort of, whether it is Parkinson's disease, whether it is reversal is possible. See, with my experience, actually there are many patients who was diabetic and Parkinson's, and usually they will be having cholesterol medicine, BP medicine, everything will be there, and also they will be taking L-DOPA and other. There are many patients who are able to come out of L-DOPA also. All the medicines, including the Parkinson's medicine also. But if it is very late stage, I don't think everything can be corrected. But some, if it is early stage, you can start at only twice a day L-DOPA or something like that. Those patients, definitely they can come out of it. Provided the first requirement is in that is actually to control of blood sugar and control of insulin. Insulin level has to come down and blood sugar has come down. So that means, and if you are taking the nutrition, optimal nutrition for the nerve cells to many of this brain, there are nerve cells is there, but in the cerebrum, 80% of the cell is not nerve. Actually, the supportive cells around it. So the damage, mainly that impact of the damage and all, they will take up actually. So the nerve cell will be in a not in fully damaged stage. So when you give enough nutrition and the correct exercise and all, and the reducing toxins, these glial cells, that is the protective cells in the brain, will get regenerated. They can very fast they can get regenerated. That is the same reason the neuropathy of the leg and peripheral neuropathy also getting corrected, because this patients who is using special chappals and all for the peripheral neuropathy, and even the sensation and the burning sensation of the numbness of the hand and feet and all, that is the typical diabetic neuropathy. No? So those patients, very fast recovery occurs. Actually, most of the patients they are regaining, but some numbness and all may persist, because we can't, there may be multiple reasons for that also. There may be some disc problems, there is some pressure on the nerves, and multiple problems will be there. But generally, and symptoms is getting corrected very fast, many of the symptoms. That is because this glial cells, neural glial cells and all, these protective cells comes under the immune system cells actually. They have a very high level of replacement actually. What they need is the correct nutrition. If you get the correct nutrition, they will regenerate and they will protect the nerve cells. And there is definitely, if you are a totally dementia patient, will you get it back? No, but that may not be possible. But some extent of memory and all we can bring it. If you can also see that if you are a diabetic patient, or when you are getting older, you can see yourself that my memory is reducing. Not in the, when you are not able to recognize the dear ones and all that, not in that stage. But if you are saying, you can diagnose that by yourself, your memory is in an early stage. You have to start in that stage. If it is totally gone, you cannot. But there are many people who was actually, I've read old people who are almost their diagnosed as Alzheimer's and taking so many medicines and to suppress their this anxiety and their behavioral abnormality and so many psychiatric sort of medicines also. And they were also able to, there are, depends on patients, there are many people who are able to come out of that also. That all depends on how much support these people are getting. And also because when your dementia and all is started, the family support is very important. And most importantly, how much food control and the diabetic control, that is very crucial. Diabetes control decides everything. And if you are willing to modulate your food pattern and do the basic simple exercises, not to go to gym or anything, just simple exercises, if you are willing, you can, it will, your immune system will take you out of the troubles actually.
When you're talking about this nerve problem, one of the finest or one of the most delicate nerves, it appears, are in the eyes. And normally we see that diabetes related nerve damage in the eyes is irrecoverable. That is the general trend of understanding. What is your opinion on this nerve damage to the eyes and any recovery possibilities?
No, more than my opinion, my experience, actually, this eye sight is gone only when the macula is affected. That is why the diabetic patients are asked to do this fundoscopy and see whether there is any damage. You can diagnose with the eye checkup, you can diagnose the diabetic retinopathy very early stage. And when it is started itself, you come out of diabetes. If it is type 2 diabetes, you just come out of it and control your sugar, and it will go back. Your vision will be saved. And I have seen many patients who have seen many times they are taken injection and all, but reasonable eyesight is there. They are just to reverse their diabetes and the sugar is normal. Then there is no risk that there is a damage. It can it will get corrected gradually. If you give correct nutrition, that nerve also can get corrected. And actually the blood vessels, actually it is nerve damage, and also the blood vessels are growing into the finer part of the most visual part of the nerve cells, accumulated nerve cells, that is the fovea of the center of the that special part is there. If there is no blood vessels there, if the actually what is happening is, in the diabetic patients, in the diabetic retinopathy, because of the lack of nutrition, blood vessel is trying to grow to that area and give them blood. Actually, when the blood vessel come to that place is damaged. In my experience, actually, one person I remember, he's actually, when we are first time we are coming, he's walking with the support. Actually, someone is holding his, or he's holding the shoulder of the actually his sister. Sisters were bringing him. But after 2-3 months, not actually 3 years here for the 3 months, and after 3 months, so they're actually in outside Kerala. They're working in other state actually. I think Andhra or Tamil Nadu or something. He was doing business there. He actually then I think by 6 months or when they come, they said he's able to manage by himself. He doesn't need any support. He's managed his business. So he's able to improve that his vision. That's very clear. He's able to. Before that, he's only getting just a light. This he was staying. Before that, he's able to see only some vague light. But now he can not identify the person exactly, but he know that with the sound he can clearly who is it. But he is able to walk without any support and manage everything. And also not only for the we are always talking about the retinopathy, it is an established diabetic retinopathy is established, but hearing loss, you just check whether most of the people who is using hearing aids is either diabetic or hypertension or both or dyslipidemia. Actually, this hearing loss also is produced by the same mechanism. It's the nerves of the auditory nerve and the vestibular nerve and all is affected. That is why there are giddiness, especially the auditory nerve is affected, and their circulation is affected. That is the reason for this diabetic this hearing loss also. I remember one lady, it's an old lady, when she came first time, she is not able to communicate anything, and even the first 2-3 weeks we cannot communicate with her with the phone. Actually, for the telemedicine we use the phone, but within a month she is able to talk, communicate directly, and also she is able to attend the phone. We are actually, there are so many tests are available. You don't go and ask the patient to do a neuro this nerve conduction study or the audiometry and all, because so it is very difficult for the patients to send all the way just to check only the blood test and minimum ultrasound scan, not other test. And we don't send for this test also because it is actually troubling the patient. They had to walk around in audio department and so many things. So we assess only with their hearing improvement and the visual. What is that is the most important. They are not the patient is not really benefiting, whether it is good for the recording purposes for the medical evidence and all. So to show that to present a patient case or to evidence-based medicine, but it is we don't go for such things basically because of the discomfort producing and the expense producing to the patient. But this all the sensory parameters can be improved with the, generally we are telling that it is not possible to reverse the neuropathy, but we can, with my experience, it is possible to some extent. The earlier the best better. Even the non-healing ulcers, that is main one of the reason is neuropathy and vasculopathy, that is diabetic vasculopathy, diabetic neuropathy, that is ending up with ulcer, which is very fast recovery is getting with such patients also. I remember one man with this charcoal foot, his whole foot is damaged. He has to put a special chapel, and even with the chapel, he is actually bleeding because this bone is totally damaged. And when he is coming, his blood sugar was 400 or above 400. He's taking insulin. He's a lean. Actually, he was not overweight also. But within a month, his blood sugar is controlled and even the ulcers were healed. But you can't put the bones in the correct position, and the damage to the foot and all is persisting. But the ulcers healed even in the charcoal foot, and he was comfortable, and the blood sugar was controlled. That is the we had to understand. When it is getting corrected, some amount of correction will definitely get to the nerves and the thing. But some maybe too much damage, you cannot. There is a repairable stage, we know, that is even the your cars or the engine, if it is totally damaged, it is very difficult to repair it. But if it is an early stage or even medium stage, there is repair is definitely possible.
Similarly, in the case of this diabetes, it is generally felt that the person who is suffering from diabetes, his cognitive capacity is also affected because of this nerve damage, and so they normally, because high blood sugar means they'll be irritable or angry, and some sort of issues, their mental issues also come up. In your opinion, what is your experience of how those issues are or can be corrected without any medications, because normally we see that medications for such issues cannot be usually given in such conditions.
See, diabetic patients definitely will be having some neurological problem because nerves is getting damaged. So they will be either irritable, they will be less active. There are people who say that after 1 month and all, the wife will be saying, so there is lot of difference, doctor. They say he's so irritable and now he's calmed. Or the patient will say that I'm always tired. When I get in the car, I'll be sleepy. Just going for sleep. I'm not able to drive because I'm getting sleepy. I'm not able to. But if I get inside the car, immediately I'll be sleepy. And now only I have started seeing the roadside and the buildings and all when I am traveling. And that is the difference actually. When that is nothing is there, actually when all the medicines is over, only this is possible. And most of the diabetic patients are hypertensive also. The tension, what you are measuring is a hypertension inside your artery. But your brain, there is nerves tension. Actually, this psychiatric the stress and what we call the stress is actually the tension of the nerves. Actually, the nerve is getting tensed, and actually there is so many. The nerve tissue is actually the brain is made of mainly the omega-3 is maximum concentrated in your brain, and omega-6 also is needed in the brain. So when the omega-3-6 ratio is deviated, you get an inflammatory disease. And along with that, if there is a sodium potassium balance also is deviated, you get hypertension. Along with the hypertension, definitely there will be stress and tension will be there. And this other cognitive problems. Cognitive problems comes because of the damage to the nerves. There will be diabetic patients, there will be silent attack on the heart and silent attack of the brain. You will not be knowing about it. And just gradually your functions are coming down. You will understand you get a stroke or transient ischemic attack that is recovered within 24 hours. We call it a brain attack, which is within 24 hours. We call it as transient TIA. And in that case, but even if much more minor blood vessels are affected, you will not be able to know it. And repeated such attacks can go reducing your mental ability, intelligence, memory, everything will be getting gradually lost. And a specific part of the brain is affected, you get Parkinson's disease. That is the way it is happening. Even this heart also the same way. Heart, some of the patients, diabetic patients, they'll go for a TMT, there will be problem. The patient is showing some ischemic changes. But when we do an angiogram, there will not be any problem. So you will be thinking that you are safe. But angiogram shows only the major blood vessel blocks are there, or it is there or not. But diabetic patients can, the problem is minor blood vessels are damaged. So the problem is they can get silent attacks. Many silent attacks will damage the heart, and the cardiomyopathy, cardiac failure can occur. That is the problem in the diabetes. And the most important thing, everyone should understand that these lifestyle diseases, if you are willing to take the challenge of correcting your lifestyle, it can be reversed. If you are taking so many medicines and all, if you are in the starting, if you are just a pre-diabetic or you are only taking one tablet, then you will be able to manage by yourself, understand basic things, and do the corrections in the food and the exercise. That will be enough. But you are already in multiple problems, multiple system, kidney affected, liver affected, heart affected, already brain, this cholesterol medication for the dyslipidemia, hypertension and all, then you have to get some support also. Then only with the guidance only you can taper off the medicines. Multiple medication you cannot come out of it without real support. So if you're willing for such a this thing, you can see you can come out of medications within a month, most of the medications, and you can maintain a much better blood sugar, much better. It's normal blood sugar, and you can bring the HbA1c also come down to normal within 3 to 4 months. It depends on if you are very high, 12 and 13 and all, it may take, and also depends on the age. Younger patients bring it fast, and the less diabetic bring it faster. If you are older, you may take a little more time, because that is the regeneration capacity of your stem cells and all depends on that.
Now, when we are talking about diabetes, generally these diabetic patients find difficulty regarding sleep habits. Some are always in perpetual fatigue, or some feel that they are lacking sleep, and at the same time this lack of proper sleep affects both the diabetic patient as well as the kidney patient with respect to health. So what is the type of, generally what type of medications can help, if any, in this regard, or is any other lifestyle corrections possible to help in this matter?
See, if the problem is many of these patients is suffering because of the medication itself. I had seen patients who's taking aspirin at night. If you're taking aspirin at night and go to sleep, then the acidity problem, it will trouble you definitely. And you'll be taking so many BP medicines. You're taking the BP medicine and go to sleep. And the BP is reducing otherwise also when you are sleeping. So you will not be getting, because this all the many of the BP medicines are actually dilating your blood vessels, and you may not be getting enough blood for the brain. So that will be discomforting you. And if you are having a problem with the sleep, you should check whether your medicine is creating reduced sleep and all. So many medications can affect your sleep. So what is my experience is, when you take, I am giving importance for tapering of the medicines, not giving sleeping pills at all, and to make them go to sleep, to bring back the rhythm of your body. See, in the nature there is, everything has a rhythm or a timing. So sun is getting up and sunrise at a particular time, and going off sunset at a particular time, and moon is circling the earth in a particular way, and the earth is circling in a particular way. So all these things are affecting you also. That is called a circadian rhythm. That is, then body also is affected by all these movements of the maximum is affected our own earth's movement and the sun's movement. We are all depending on totally on sun for everything, and earth and sun is actually supporting, and definitely moon is also making an impact on us. So just like that, you should also sleep in a correct time. That people are not to, most of the patients will be irregular sleeping time and getting up time. That is when it is corrected. And for correcting that, one is go to sleep in a particular, so according to our own lifestyle pattern, we can fix it. And the most preferable way is getting up, sleep at 10 o'clock and getting up 6 o'clock, or sleep at 5, or depends, everyone's convenience accordingly. And for that, we are what a maximum medicine what I prescribe is only that melatonin. That is when the old age and with multiple problems, our melatonin, that is a sleep hormone actually, that is come from the pineal gland from the up, and actually this pineal gland is the one who's controlling all the other hormones. So there may be deficiency because of this diabetes. That also, that nerve cells which is producing, that also can be affected. For a short temporary time, we can use that, not for everyday melatonin, no. But for a short time to regularize the sleeping, we can use that. But that alone will not help. You had to give the correct nutrition for the brain, bringing up the brain also to produce that melatonin cells, producing cells has to produce, then that also needs some certain amino acids. So that also to be given. So within a month, most of the patients most of the patients, especially kidney patients, diabetic patients, especially around for those comes to me, will be having this life. Those who are coming for clinically supported lifestyle correction will be having so many diseases, not one or two. There will be, if you written you're writing it, you need a page for their discomforts and diagnosis actually, because diabetic patients, all the systems will be affected. Heart will be affected, liver will be affected, kidney will be affected, brain will be affected, peripheral neuropathy will be there, hypertension, cholesterol, so many things will be there. Even varicose veins. Even along with the diabetes, there will be varicose vein also. So varicose vein also may be creating problem for the ulcers also. And maybe along with that, there will be hypothyroidism, Hashimoto's thyroiditis, and arthritis, and even osteoarthritis. Maybe advised to go for a knee replacement, and multiple problems will be there. But all these things will come down parallelly because we are correcting the body. You are empowering the immune system and regularizing, correcting the hormone system. So every system will get the parallel benefit. So whatever medicines, whatever problems you are taking medicine, you can get come down from that in a systematic way. Only thing, you should be willing to take the challenge as to correct your lifestyle. So if you want every day say Keralites and all like biryanis actually. So biryani and or you need every day, if you want to take bread and whatever your favorite food, you cannot do that. You have to come down. If you are diabetic, if you want to correct it, you should be willing for a low calorie diet, low carbohydrate, not only low calorie, also low carbohydrate. If you are obesity and all, you have to have a low calorie diet itself. And actually in this clinically supported lifestyle correction for the obesity and all, we try to reduce the calorie intake to around 650 calories, but ensuring all the nutrition and ensuring that there is no color preservatives or the food additives are there as much as possible, and getting enough exercise also in a systematic way. With that, it is possible. That is the only thing that is possible if your body immune system is having enough capacity to support you or rebuild your body. If you have taken so much of anti-cancer medicines which is destroying your bone marrow, then it is entirely different. And if your kidney is already totally gone, or your ear is already totally damaged, or your eyes are totally damaged, retina is totally damaged, if the fovea is damaged, then you won't be able to reverse. But if it is an early stage, if it's a repairable stage, definitely that depends on your immune system and what you are giving to the body, whether you are willing to accept the correct food, not the taste, the nutrition. You should learn taste and to know the taste of the food according to the nutrition need actually. Now your system is actually, we are fooling our sensation, the tongue, with the artificial tastemakers and all. So It will take within 2-3 months. You will start knowing which is when you are taking a food. If you are taking ice cream or junk food, you will feel that it is not tasty. You feel that start feeling that chemical taste. Actually, you won't like it if you after you really taste the what is the correct nutrition actually.
With this, we come to the end of this session. Thank you.